All right, good afternoon. We are here with Dr. Lisa Learn. Dr. Lisa, welcome.
Thank you.
Thank you so much for being part of this initiative and volunteering your time. I know you're a very busy doctor, and I'm confident that the conversation that we're going to have here today is going to be very valuable for anyone that is either already in business or looking to get into business. So, again, thank you for your time. And when you're ready, we can get started.
All right, I'm ready. Thanks.
So I kind of already gave a little bit of a clue by saying you're a doctor. So officially, let me ask you the question. Tell us what you do and how long you've been doing it.
All right. I am a board certified plastic surgeon, and I practiced initially in Pennsylvania and decided I could no longer handle the cold. So I moved to Florida, and I've been practicing for about 21 years.
Fantastic. Wow. So that's pretty impressive, especially when you say 21 years. Some people might challenge you like, wow, you started when you were 5. That's actually amazing. So
I'm
that
actually 95 now.
yeah, that's pretty amazing. And tell us, being a doctor is one of those things that, so many people aspire to be. Is this what you wanted to be while you were growing up?
Actually, I kind of knew I wanted to be in the medical field. I had an injury and I was left with a gaping wound in my leg, and I wanted so badly for the doctor who was sewing me up to let me watch, but he wouldn't let me, and I was really sore about that. But I kind of got the clue that yeah, medicine might be my calling.
Yeah, because I think that was definitely a message because whenever I got hurt, I looked the other way. So the fact that you actually wanted to see what was going on, that was definitely a clue that you weren't squeamish about things like that.
Age 13, I wanted to take my own sutures out, but again, they wouldn't let me.
Ah, look at that. They should have, right? Like if you would have got started back then, imagine. So
Right.
that's pretty amazing. And so tell us a little bit about the areas in which you practice in, and who's an ideal client for you, or who are your clients?
Well, as a plastic surgeon, there's really two avenues. There's cosmetic and there's reconstructive. I'm probably about 80% cosmetic and 20% reconstructive. I still do breast reconstruction. So it's kind of surprising. Over the 21 years, my demographic has kind of expanded exponentially. More men are now getting procedures, and younger women on Instagram are so into prophylactic Botox, getting it before they get wrinkles. So my demographic has gone from something as small as like 45 to 75-year-old women to, I would say, probably 45 to 75-year-old men and women. And then I've also added now the 25 to 35 uh, millennial users.
Yeah, that's fantastic. And it certainly makes sense that I guess it's easier to maintain and keep something up before it gets bad as opposed to fixing a bunch of things afterwards. So it makes sense. And I'm glad that people are taking more care of themselves and doing the right thing early on. So that's pretty interesting. And when we think of doctors, we typically think of doctors like only working in big hospitals, but the reality is that doctors like yourself can have your own practice, which essentially now you got two titles. You got doctor and you got business owner. So kind of going off script a little bit, how was that transition from really going from doctor to business owner? What was that like for you?
That was really tough. I can remember when I was in Pennsylvania, I practiced there for 11 years. I was in a hospital owned practice. So all I had to do was get up and go to work. And that was great. But I knew that there was so much more I wanted to do with the business. So when I moved to Florida, I had the opportunity to go in with a hospital. And I'm like, I want to see what I can do on my own. And it was overwhelming. I mean, you've got what you're good at, and sure, you can do it over and over and over again, but then having to run a business, having to manage employees, it's kind of a shock. But I just love the way it's progressed, and it's really kind of a passion. The business part of it is a passion for me, and as I get closer to retirement, maybe that's going to become my retirement plan is going to the business and letting some young surgeon take over.
Yeah, that's amazing. And everything that you mentioned is really familiar to me. Obviously, being a business coach, we work with a lot of really smart, talented people that are great at what they do. doctors, lawyers, architects, engineers, even plumbers, dentists, and pest control companies. And they're all great at what they do, but a lot of them really didn't have or the business education or training behind it. And so where we find ourselves as business coaches really being the most help is working with business owners who, again, are great at what they do, but maybe need like some guidance on the business side of things. So it sounds like you actually transitioned really well. So congratulations on that. And so tell me, what's been your biggest learning since going into business for yourself? What's been the biggest area of learning, or just your overall biggest lesson that you've had since you became a business owner?
My biggest obstacle, I think, was I wanted to be, I wanted to have my fingers in every single corner of the practice, being business or, the medical side. And I think the hardest part for me was bringing on new people, I was the practice manager for my own practice for 6 years. And I was this close to burnout. And so, I made the decision and talked with my business coach about adding a practice manager, and that has been the biggest one of the biggest strides I've made as far as personally being able to focus on the business but yet delegate some of the business stuff to her and to some of the other employees. But it's freed me up, it's taken me out of that realm of burnout, and I think that's been probably the best thing to happen in my practice.
Yeah. And certainly something that I think every business owner needs to come to grips with and figure out on their own is the expansion, the delegation, bringing on the right people, having them sit in the right seats and do the right job. So that makes a lot of sense. Very common in business overall. So tell me, what does the future look like for you? And now that you're, X amount of years into running your own successful practice, what challenges do you see moving forward?
Well, right now we're running out of space. We have to expand or we have to buy into some commercial property. Right now we lease. So I think the time has come for us to actually figure out what we need. We're starting a med spa in addition to the medical practice. And then again, the next step after that will be to add another, or maybe even before we find space, is to add another physician, another
Well,
plastic surgeon.
how exciting is that? What sounds like, the some of the challenges that you were facing early on versus the ones that you're looking at now. These sound like kind of good problems to have: expansion, growth, outgrowing your space, maybe expanding into different areas. So that sounds pretty exciting. And as we say in business, right, it's always about figuring stuff out, right? Like we go from figuring one thing out to figuring the other thing out. So that sounds really exciting, and congratulations on what you're going to be handling next in your business. So one of the things that I always like to ask is, what would you say to someone like someone just like you, maybe 20 years ago, someone that's either getting into business or thinking about getting into business for themselves? What advice or what would you say to that person?
Well, it comes down to what I experienced. Like I thought being a plastic surgeon, many plastic surgeons have successful solo businesses. I thought that the surgeons were, the key, that they did everything. And I think the best advice I can give is to don't, not to be afraid to get help. To me,
Mm.
I thought, no, I've got to do this. This is me. I've got to know everything, or I'm going to run into trouble. And getting a business coach to help me understand, what I need to focus on, where my marketing money needs to go. That's all extremely important. Don't think you have to do it all on your own. Just ask for help.
Really great advice. And if you think about it, that's one of the things that I talk about all the time is like some of the most difficult things that we learn to do. We didn't learn to do those things on our own, right? Like we had parents as babies and as children because we had to learn the fundamentals from them. Then we went to school. We had teachers and mentors then. So all through our education process, even starting a new job, like basically everything that is pretty significant in our lives, like we've done with the mentorship or the guidance of someone else. So I always say to people, what makes you think that like running or even starting a business is any different than that? Because it's kind of up there in the level of difficulty of doing it right from the start. So kudos to you that you figured that out and you did that when you did, because the opposite of that might be either, a lot of businesses kind of get stuck, they tap out, they give up, they burn out, all these other things. So it takes a lot of courage and confidence to be able to say, I don't know everything, because nobody knows everything. So that's pretty amazing. And so along this entrepreneurial journey, what have you learned about yourself?
Um, that if there's something that needs to be done, I can certainly do it. When I started this and I started the business and I started thinking of, people would talk to me like, Q1, your fiscal, blah, blah, blah. I'm like, oh my God, those words are foreign to me. They're not Latin. and so, uh, yeah, I think I'm just amazed how a person can adapt. With COVID too, we had some of the best months ever, the best year ever during COVID, and I think it's adaptability. I think I've become much more adaptable.
Yeah, I think you hit it right on the head there by saying that, because we have to evolve. We have to evolve as business leaders, as business owners. We cannot continue to do the same thing, because the industry, technology, the world will move on, and eventually our competitors will pass us. They'll take over. So the fact that you were able to not only survive but thrive during the past couple of years, that's an amazing accomplishment right then and there. So congrats on that. And because this video is going to be shared throughout social media, we're going to share it with other business owners, maybe people looking to get into business, but also maybe people that may want to do a little bit of work here and there. So is there anything exciting that you might want to say to someone that go, oh my God, maybe I should go in and see Dr. Lisa? Anything exciting that you would want to share with them that will kind of get them to book in a consultation with you?
Yeah, I mean, plastic surgery isn't all cutting. There's a lot of things. It's very rewarding to be able to help someone with something that's been bothering them for a long time. And I keep telling patients, it's not vanity. It's just putting your best foot forward. So we have non-ablative things. We have non-ablative lasers. I'm sorry, non-invasive things like non-ablative lasers, meaning it doesn't take away tissue. But things like that can just overall make someone feel much better about themselves. And in the end, it all comes down to your self-esteem and, feeling good so that you can do good.
Yeah, that sounds great. And the more I listen to you, the more I think about maybe I need to book an appointment. So don't be surprised if you see me in your office there in the time coming up here. But I don't want to take too much more of your time. I think the everything that you shared here today has been really amazing, very beneficial and helpful, and really enlightening. And I think that whether you're an experienced business owner or just thinking about getting into business, I think some of the words of wisdom that you shared here today is going to be extremely helpful to many people. So I want to thank you again for your time, your wisdom, and I hope to see you again soon.
Thanks for having me.
Thank you, Dr. Lisa. Bye bye.
Bye.